how should it be?
Thin.
Well, depends on the size of the chambers, I guess. Slick and smooth. That's right. It ought to be slick and smooth. Why do we want all the surfaces that our blood touches to be slick and smooth?
So there won't be like friction.
Well, yeah, who likes to stick to rough edges in your circulatory system?
White blood cells.
Not white blood cells. Who will stick to rough edges and cause a clot if you leave any? Not red blood cells. What? It is platelets, yeah. Platelets stick to rough edges and form a clot. And then, guys, what the middle layer is called the myocardium. What is it made out of?
Muscle?
Yeah, what kind of muscle?
Skeletal?
That would be voluntary.
Oh, wait.
Cardiac, yeah. Cardiac muscles in the heart. Okay, guys, and then the outer layer of the heart is called the epicardium, or it could be called the visceral pericardium, but we'll stick with epicardium. All right, guys, so where does the right atrium send blood to? The right ventricle. But first, the blood has to get past what valve to go from the right atrium to the right ventricle?
Tricuspid.
Tricuspid. Always try to do right. And then the right ventricle, where does he send blood? Well, close. We skipped a step. Pulmonary arteries. And what color are the pulmonary arteries? Blue. And how do they get by being arteries but being blue? Well, they do carry deoxygenated blood, but what makes them arteries, even though they're blue? They carry blood out of the heart or away from the heart, sure. Now, guys, what valve did we have to get past to go from the left or to go from the right ventricle to the pulmonary arteries? The pulmonary valve, sure. And then, guys, the pulmonary arteries divide, and they finally divide into what blood vessel? You know they must have divided into this blood vessel because you see a color change. What's the only blood vessel thin enough for gas exchange, which is what they mean when they say color change? Capillaries, yeah. So arteries divide, and then eventually there are microscopic arterioles, and eventually they divide into capillaries, which are only one cell thick, give or take. And so the capillaries are able to do the gas exchange, which is always represented by turning colors. Yeah. And then the blood comes back to the heart via the pulmonary veins, right? There's 4 of those, 2 on each side, but all 4 of them go to the left atrium. Now, blood in the left atrium, when the left atrium contracts, it's going to send blood to the left ventricle, but what valve do we have to get past? Bicuspid or mitral. Yeah, he's got an AKA. Now, blood in the left ventricle, when the left ventricle contracts, that blood is sent to the aorta, and it had to get past the aortic valve to get from the left ventricle to the aorta. And the aorta branches at least 100 times and branches into arterioles, which branch into capillaries, which drop the oxygen off and pick up the carbon dioxide. And then the blood goes back to the heart via the 2 biggest veins in the body. What are they? Yeah, the superior and inferior vena cava. Vena means vein, and cava means big, like cavernous. So there's the top big vein and the bottom big vein. All right. Guys, what kind of respiration happens in the lungs? We get some from Unit 8 as well. What kind of respiration happens in the lungs? External respiration happens in the lungs. That's where we take the CO2 out of the blood and hopefully breathe it out and put oxygen from the air in the blood. And then what form of respiration happens in the tissues? Internal. That's where we give the oxygen away to the tissues so it comes out of the blood. We take the CO2 from the tissues and put it in the blood. Kind of already did the valves, I guess. Guys, those are your literal heartstrings, your chordae tendineae. I think we've all seen those in lab by now. They keep your tricuspid and bicuspid valve from blowing open backwards. Oh, okay. Now, guys, what are the first branches off the aorta? The coronary arteries, right and left. And then the coronary arteries branch a bunch of times. And specifically, what are the coronary arteries there to supply oxygen to? Yeah, what layer of the heart needs the most oxygen? The myocardium, because the myocardium beats at least 70 beats a minute your whole life, even when you're asleep, right? And we know that working muscle requires a lot of ATP, and we make ATP best with oxygen. Yeah, so definitely that's why we have to have coronary arteries, and you can see them right there. Now, when the blood is done dropping off the oxygen and picking up the CO2, how does it get back? We send it to the myocardium. Now we got to get it back. How do we get it back? Say what? Well, they're not coronary veins. They should be, but they're called the blue streaks on this guy. You got coronary arteries, and then what do they call the veins? You guys, you got coronary arteries. The first branch is off the left ventricle, which came right from the left. I'm sorry, the first branch is off the aorta, which came right from the left ventricle. So the blood goes to the coronary arteries. Fresh oxygenated blood goes to the coronary arteries, feeds the myocardium, and then how do we get it back?
Cardiac vein.
Cardiac veins. Yeah, I don't know why they don't have the same name, but they don't. And then all the cardiac veins drain into what vessel? The coronary sinus. So in the context of the cardiovascular system, a sinus is a thin-walled vein. Yeah. And the coronary sinus dumps into the right atrium. So amateurs might think that the right atrium receives blood from the superior and inferior vena cava, but professionals know, yes, those two, but also the coronary sinus. Right? Coronary sinus. All right. Okay, guys, what are the 3 layers of the arteries and veins from the outside in? Yeah, tunica externa, mostly collagen protein. Tunica media, what's it usually named after? Or what does it usually have most in it? The tunica media. What's usually in the tunica media of most arteries and veins? Not always, but usually. Smooth muscle, that's right, smooth muscle. Smooth muscle lines lots of hollow internal organs, and your blood vessels are no exception. And then what do we think about the tunica interna? How should it be? Same as the endocardium. Slick and smooth. Yeah, we want it to be slick and smooth. Or else who might try to stick there? Platelets, and they might try to have a clot. Guys, the capillary is pretty much just the tunica interna. That's why it's thin enough for gas exchange. It's really thin walls in the capillaries. Guys, what is the difference between the tunica media of an artery, usually, and the tunica media of a vein? Yeah, vein has a thinner tunica media. And why can the vein get by with a thinner tunica media? Not as much pressure, which is the same reason veins have to have valves. Yeah. Now, guys, most of the time in arteries and veins, the tunica media is smooth muscle. But with our big arteries, what is in the tunica media instead? Like with our aorta and our other large arteries. Elastic fibers, yeah. So our elastic arteries have elastic fibers in the tunica media. Our muscular arteries have smooth muscle in the tunica media. They're usually smaller. We okay so far? This all sounds familiar? Okay. All right, we kind of talked about the tunics, and we talked about the elastic arteries, how they have elastic in their tunica media instead of smooth muscle. You wouldn't want your aorta to constrict. The smaller arteries and the veins generally have smooth muscle in their tunica media. Hey guys, what's an arteriole? Yeah, a little tiny artery, a little tiny microscopic artery. It would be muscular. And then arterioles branch into capillaries. Yeah, the smallest blood vessels, they're thin enough for gas exchange. So this is where color change in the textbooks actually takes place, because the capillaries only have the tunica interna. And all capillaries are in beds, like a capillary bed, a network, where the cells, which they don't show, are in through here, and the cells get the oxygen and drop off their CO2. And then all the capillaries merge to form a little tiny vein called a venule. And multiple venules will merge with each other to form a macroscopic vein, right? So arterioles are microscopic. Venules are also microscopic. Arteries are always branching, and veins are always merging. Don't really care about the precapillary sphincter too much. So we already said venules are just little tiny veins, and they merge to form bigger veins, which merge to form yet bigger veins. Hey guys, I don't mind telling you, and this is not on the test, but just in case you're ever curious, a venous sinus, like we have on the back of the heart, is a thin-walled vein because it doesn't have a tunica media at all, in case that was bothering you. I've already talked about this stuff. Guys, what's an anastomosis? Yeah, an interconnecting network of blood vessels. By definition, all capillaries pretty much are in anastomotic networks. What's a way that we can build more anastomoses between our coronary arteries? Cardiac exercise, that's right. And what's an anastomosis we all have at the base of our brain? It connects the No, that's the structure at the base of our brain, but this would be, that's part of our brain. This would be the blood vessels that feed it. Remember, we have the four arteries that go up to the head, the right and left vertebrals and the right and left internal carotids, and they all form a circle at the base of the brain so that our other arteries can branch from that circle and go to the brain. What is the name of that anastomosis that we all have at the base of our brain? The circle of Willis. Yeah, the circle of Willis. And we'll see him on the slides here in a minute. Okay, guys, our veins are under very low pressure. We know, well, somebody tell me, what is the muscular pump that we use to get blood in our veins back to our heart?
Contractions of skeletal muscle.
Yeah, contraction of skeletal muscles. If you've got a vein and it's got valves in it, when you massage that vein, it'll push the blood the direction it's supposed to go. If you lock your legs, the blood won't go backwards because of the valves, but it won't go forwards either. So you got to keep massaging those veins to keep the blood flowing back towards your heart. There's also the respiratory pump. Anytime we suck in air towards our lungs, we also suck blood towards our heart. All right, guys, I'm a red blood cell and it's my destiny to go to the right arm. I'm in the left ventricle and the left ventricle starts to collapse in on me. Where do I find myself? The aorta, yeah. And then when the aorta contracts, or when the left ventricle contracts, I'm in the aorta. Do I get off the highway on the right or left coronary artery? No, I'm trying to go to the right hand. So which artery of these that we can see am I going to get out of the aorta on? Well, I'm trying to get to the right hand. It's true that there's a right subclavian. Well, first, I'm gonna have to take the brachiocephalic artery, and then it's going to branch, and I'll go to the right subclavian artery. I don't know why we're like this, but the right side coming off the aorta has the brachiocephalic. The left side has the left common carotid artery and the left subclavian artery coming right off the arch. Not sure why we're like this, but we are. Brachiocephalic just means arm head. So there's that. But in any case, on the right side, first I'll take the brachiocephalic, then I'll take right subclavian. Now, guys, I'm trying to get to the hand, so I'm going to stay in the right subclavian. It's going to have branches that branch into arterioles and capillaries in all the regions it travels, but I'm going to stay inside it, and I'm going to stay inside it when it becomes the axillary artery. And then once it gets into my arm, it'll be the same artery, but it'll be called brachial. And then I got two options. I can take the thumb side artery. What should we call the thumb side artery? Radial, or I can take the pinky side artery. What should we call that one? Ulnar.
I'm sorry.
Yeah. And then I can get back through veins. What if I took the thumb side vein? What's that one called? And the pinky side vein? Ulnar. And they go up and merge. Arteries branch, but veins merge. So the radial on the thumb side and the ulnar on the pinky side, same type, go up and merge to form the brachial, which turns into axillary, which turns into subclavian. Yeah. So usually the arteries and veins have the same name. You just reverse course, usually. All right, guys, let's say I was trying to get down to the left kidney. The left ventricle contracts. Do I get off on the right or left coronary artery? No. Do I get off on the brachiocephalic artery? I'm trying to get to the kidney? No. Do I get off on the left common carotid? No. How about the left subclavian? No, I'm trying to get to the kidney. So I'm going to stay in the aorta. I'm going to stay in the aorta until it turns into descending aorta. And we're going to pick the descending aorta up right here. And there's going to be a branch off the descending aorta that goes to the kidney. What do we call that branch? The artery that goes to the kidney? Renal. And then we're going to drop off the oxygen, pick up the CO2, and we got to get the blood back so it comes back through the renal vein. And the renal vein, like most veins, drains into inferior vena cava. And remind me, where's the inferior vena cava going? To the right atrium again. Yeah. Yeah. All right. Already talked about coronary circulation. Yeah, talked enough about veins, I think. It goes on and on. Okay, guys, when someone talks about their pulmonary circulation, what are they talking about? What's the pulmonary side of the circulation? The right side, right? So to go from the right side of the heart to the lungs and back, that's pulmonary circulation, right? Pulmonary means lung. We already knew the right side of the heart takes blood to the lungs. The left side of the heart has oxygenated blood and takes it to the body, so that's the systemic circulation. So the pulmonary circulation is your right ventricle to your lungs and back. The systemic circulation is your left ventricle out the aorta and then back to the heart. Guys, the liver is a special situation. He gets an artery off the descending aorta, just like we'd expect. He has a vein that drains into the inferior vena cava, just like we'd expect. But he also has another vein that drains into the liver from the digestive system. The digestive system doesn't drain straight into the inferior vena cava like you'd think. It drains into the liver. And that's called the hepatic portal vein. Already talked about the coronary circulation. Guys, here it is, the circle of Willis. That's an anastomosis that we all have at the base of our brain. The blood vessels coming in, all four of them, all four arteries, the right and left vertebrals and the right and left internal carotids all form this circle called the circle of Willis. And all the arteries that come off the circle go to different parts of the brain. But this is a safeguard just in case one of those four is a little bit pinched. We can keep moving blood to the circle and to the whole brain. Guys, why is this thing called a vein even though it's red? Why is the umbilical vein called that even though it's red?
Oxygenated blood.
Well, it's red because it has oxygenated blood. Why is it called a vein even though it has oxygenated blood?
Isn't that because it's the babies?
Yeah, it's the baby's vessels, right? The blood, your vessels and your vocal cord and your umbilical cord were from you. And so this is one of your blood vessels and it's taking blood to your heart. So it's a vein. Now the umbilical vein lands and connects to the inferior vena cava. And you guys just told me, where does the inferior vena cava take blood? The right atrium. But we don't want oxygenated blood on the right. Oxygenated blood is supposed to be on the left. So we got to have two bypasses. What do we call the bypass between the right atrium and the left atrium? My email. What do we call the bypass between the atria? Between the right atrium and the left atrium?
Ductus.
No, that's a different one. So-
Forming.
Well, the septum's in the ventricles. This is the foramen ovale, right? The oval-shaped hole between the two atria. And just in case we didn't get it all, we've got another bypass right here between the pulmonary artery and the aorta, and it's called, this is the ductus arteriosus. So the fundamental problem is the umbilical vein is bringing in oxygenated blood from the placenta. But the umbilical vein goes to the inferior vena cava, and the inferior vena cava goes to the right atrium. So the fundamental problem is we've got oxygenated blood on the wrong side. So we've got to get it over to the correct side. And to get it over to the correct side, we need two holes. We need a hole between the atria called a foramen ovale. That'll let it go from right where it's not supposed to be to left where it's supposed to be. And then we need another hole called the ductus arteriosus between the pulmonary artery, which is trying to take blood to the collapsed lungs, and the aorta. This. Oh, okay, guys. So what is all the green stuff? Yeah. So why do we need a lymphatic system?
It produces white blood cells.
It does produce white blood cells. I was talking about its other job, but that's absolutely true. What would happen even if you didn't get sick if you didn't have a lymphatic system?
They won't feel better.
Well, right. It is part of the immune system, but it's got two kind of jobs. It is that you're absolutely right. It is essentially the immune system. It makes white blood cells. That is correct. But I'm looking for his other job.
It brings it back to the bloodstream.
It brings fluid back to the bloodstream. So guys, what's up with our capillaries? They leak, right? So we know that these are blood capillaries because we have a color change. So we know that since capillaries leak, there's some leakiness going on here. So nobody knows why we're like this, but our capillaries, the millions of miles of microscopic capillaries, the tiniest blood vessels, they leak plasma. And if we didn't have a way of getting that back to our bloodstream, we'd have horrible swelling and we'd have low blood volume, right? That wouldn't be good for a couple of reasons. So we have to have this lymphatic system that collects all that fluid and returns it eventually to the bloodstream. On its way, it's going to pass through lymph nodes, which work like oil filters, which will hopefully kill the bad guys. All right, guys, you've got a right lymphatic duct and a left lymphatic duct. Where does the right lymphatic duct drain into? What blood vessel does the right lymphatic duct drain into? Go back to my email for a while. The right lymphatic duct drains into what blood vessel? Yeah, the subclavian vein. The right subclavian vein. And the left lymphatic duct drains into the left subclavian vein. Okay, so far so good. So we know that our lymphatic system is there to collect the fluid that leaks out of our capillaries, but it's got to return that fluid, and it does it by all the lymphatic vessels merge and eventually form the right lymphatic duct and the left lymphatic duct. The right lymphatic duct puts that fluid back in the right subclavian vein. The left lymphatic duct puts that fluid in the left subclavian vein. We're okay with that? Yeah. Okay, guys, your right hand, where does the fluid that leaks out of the capillaries go? Which duct? The right subclavian vein, right? Because the fluid's going to leak out, be collected by all these lymphatic vessels. They're going to merge and merge and merge with each other until they form the right lymphatic duct. It's going to drain into the right subclavian vein. So we're okay with that, right? Like all of my cells in my hand, they need oxygen. They need to get rid of CO2. So the blood's going to combine and do that for me. But on its way, the capillaries leak fluid. So I have to have lymphatic vessels to pick up that fluid and merge and merge and merge with each other to dump that fluid back into my right subclavian vein. It's the same on the left, only for some reason, the whole body, except for what's in green on this guy, is served by the left lymphatic duct and goes into the left subclavian vein. So the capillaries in my right foot leak fluid like all capillaries do. They leak plasma. And where will that plasma be eventually returned to the bloodstream? Right, it'll go through the left lymphatic duct into the left subclavian vein. So your lymphatic system collects fluid that leaks out of your capillaries and returns it eventually to the cardiovascular system. So they make a big deal about how lymphatic vessels pick up fluid but don't let it go. All right. Guys, what does this woman have? I'm not going to have you name the ailment, but what's going on with this woman? Or man, perhaps. I can't tell. Why does this person have such grotesque swelling? They have edema or swelling. What's going on with this person? Why do they have so much swelling? Yeah, their lymphatic system, the tubes that collect the fluid and bring it back eventually to the bloodstream, those tubes are blocked by a worm that's living there, right? So kill all mosquitoes. Okay, guys, then we kind of switch to hematology. You're okay with the idea that your cells are always using oxygen and creating CO2 as a waste product? Yeah. All this stuff kind of makes sense. Guys, let's talk about, hey, what's plasma? What is plasma? Right, where do we find plasma? Right, so plasma is the what of the blood? The fluid, right? Plasma is the fluid of the blood. And guys, what is the difference between plasma and serum? Right, serum is just like plasma, only serum is missing the proteins that cause clotting. I don't know why, but that's apparently important. All right. Hey guys, what's the fancy name for red blood cells? Erythrocyte. What do? Yeah, they're full of a protein called hemoglobin that you might have learned more about depending on where you're heading after this. What do leukocytes do? Leuko. Yeah, they try to kill pathogens. And what do platelets do? Prevent clotting? They start clotting, right? Once they stick to a rough edge, they will send out signals that'll turn on all those clotting proteins and you'll have a clot. All right, guys. I think I mostly left this for microbiology. But blood groups. So who knows their blood type? What's your blood type?
B positive.
That's fine. What's your blood type?
O positive.
O positive. Okay. Could either of us give blood to you? No. Could you give blood to us? Yeah. If someone was sitting here and they were AB positive, could they take my blood? Yeah, because their immune system's seen it all, right? So someone who's AB positive, their red blood cells already have the A spike protein. They already have the B spike protein. And if they're positive, they already have the RH protein. So that means they don't make antibodies to any of them. I'm type B, which means I make antibodies to A. I'm not going to try to trip you up with this language, but just in case you ever see it again, I have B proteins on my red blood cells, and sometimes they call those antigens. They would say I have B antigens on my red blood cells. And then antibodies stick to antigens. So I have B proteins on my cells, and I have antibodies against A. So if you give me A blood, it's going to stick all those new red blood cells together and cause massive vascular flow problems. Someone who's type AB, though, they don't make antibodies to A or B. And if they're AB positive, they don't make antibodies to A or B or RH. So one more time, I'm B positive. Could I give blood to someone who is O negative? Could I take their blood?
Yes.
Yeah. Okay. So really the RH factor is just another protein that works exactly the same way for the most part. Don't show the recipient any RH protein if they've never seen it before. And that's what they mean by positive or negative. I should really say that my blood type is B, RH positive, right? But that's not how people talk. All right, guys. Now, I'm not going to lie to you. I'm looking at the test while we're talking here. Not everything I said is going to be on the test. I actually have this I actually have this conspiracy in my mind where I want you to know these things, but I think we covered just about everything here. Let's look at Unit 8. Which is the respiratory system. Okay, guys, explain to me the difference between ventilation and respiration.
I think ventilation is when you're receiving the air, but it's not. It's-
Well, you can have ventilation without respiration. Ventilation is just,
When you push air in.
right, just air coming in and out. That's all ventilation is. Now, we need ventilation before we can do respiration, but respiration specifically refers to
That's extreme.
gas exchange. And where do we put oxygen in our blood and take CO2 out? Where does that happen? Where do we put oxygen in our blood and take CO2 out? The lungs. Yeah, that's what we do. And guys, when we do that, that's called external respiration. And where do we take oxygen out of our blood and take CO2 and put it in there? Say what?
The tissue.
Yeah, between the blood and tissues, that's internal respiration, right? So I don't phrase it this way, but let's just make sure we can do it this way. If I told you there's a form of respiration where carbon dioxide is coming into the blood and oxygen is leaving the blood, which one is that?
It's
Internal.
Internal. And if I told you of a form of respiration where oxygen was coming in and CO2 was leaving the blood, which one would that be? External respiration. Did all that, I feel like. Okay, guys, so let's go over this. What is this? We need to know airflow. So what is this? You knew before you came in here. Nasal cavity or nose, and then the air goes down your throat. What's the name for your throat? Pharynx. Now let's split it out. What's the name of your throat behind your nose? The part of your throat behind your nose. What's that one called? Nasopharynx. So you breathe blood in through your nose, or you breathe air in through your nose, and then the air goes into your nasopharynx, and then it goes into your oropharynx, and then it goes into your laryngopharynx, and then it goes into your what is the thyroid cartilage, but what's the whole structure called? Well, it goes past the epiglottis into this area where your vocal cords are.
maybe
That's further down. Okay, guys.
is it thyroid cartilage?
Well, the thyroid cartilage is a part of this overall structure. So we breathe air in through our nose, and then it hits the nasopharynx and the oropharynx and the laryngopharynx, and then it goes into the larynx. Yeah, the voice box. And then it goes into the windpipe or trachea. Yeah. Now, guys, when we're breathing, our epiglottis is up. But when we go to swallow, our epiglottis swings down. Yeah. And guys, I don't know if I mentioned it, but you have that hanging down thing in the back of your throat. It looks down, the uvula. That's here. Uvula actually means grape. We need to know that too. This swings up when you swallow food or water. So the uvula swings up and the epiglottis swings down. And they're both there to protect your air passages, right? So we don't want the stuff we swallow to get up into our nose. So the uvula is kind of a flap that stops that from happening. And we don't want it to get into our larynx and trachea. So the epiglottis is a flap that closes down. So the uvula swings up, epiglottis swings down. If I missed anything. Oh, and guys, after the trachea, so there's the larynx and the trachea, but after the trachea, the air goes, just to complete that thought, after the trachea, the air goes into the bronchi. So one is a bronchus, more than one is bronchi, right, or bronchi. All right. Okay, guys, what do we call everything in our respiratory portion before we get to the alveoli? What do we call all the tubes? And so our nose, our nasopharynx, our oropharynx, our laryngopharynx, our larynx, our trachea, our primary bronchi, our secondary bronchi, our tertiary bronchi. No, I think someone said it. All those tubes. What is? Well, the vocal cords are part of this, but all those tubes, remember, we can divide our respiratory system into upper and lower, and we can also divide it into conducting and respiratory, which sounds weird. So we have the conducting portion of our respiratory system and the respiratory portion of our respiratory system. Everything we've done so far, so our nose, our nasopharynx, our oropharynx, our laryngopharynx, our larynx, and our trachea, and then primary bronchi and secondary bronchi and tertiary bronchi, those are all part of our conducting system. And it's not till we get to the alveoli where we actually do gas exchange, and you know the word for gas exchange is respiration, right? So we're not till we get to the alveoli are we in the respiratory portion of our respiratory system. Guys, ponder CPR, right? When you do they still do rescue breathing in CPR? They got rid of that. Still sort of. So when you breathe into the other person's air passages, right, the air you're breathing in has never lost oxygen, right? Because the first air out of your mouth is going to be the air that was in your conducting system, right? So that's why rescue breaths work at all. But in any case, the part of our respiratory system that happens before the alveoli is called the conducting zone because it conducts the air where it needs to be. Only when it gets to our alveoli are we in the respiratory zone of our respiratory system. Yep. Hey guys, what separates the nose and mouth? Some bones separate the nose and mouth. What bones separate the nose and mouth? Find a better picture. This is good. It's the hard palate. What two bones is the hard palate made out of? The maxillary and you had to know these way back in lab 5. What is it? I can't hear you. But
She said,
no, it's the maxillary and the bones that I remember there was 2 of them. Maxillary and palatine bones. Yeah, they make up your palate. Now, guys, your hard palate is made of the maxillary and palatine bones. Your soft palate is just where you got no bone. All right. What kind of tissue lines places that are meant to deal with air and only air? Pseudostratified columnar epithelium. That's right. Pseudostratified columnar epithelium. Yeah. But what tissue lines the areas that are shared with our digestive system and have to be tougher? Like our oropharynx and our laryngopharynx. Stratified squamous epithelium. And there it is. Lots of layers, much tougher tissue. Of course, all epithelium has connective tissue underneath it. All right. Yeah, what this tube right here, what's it called and what's it draining? The auditory tube, yeah, or people call it the eustachian tube. And it's draining what into the nasopharynx? Yeah, what part of the ear? The middle ear, the part behind your eardrum. Guys, what holds the trachea open? Why doesn't the trachea just come? The cartilage, yeah. And guys, the primary bronchus, or the trachea and the primary bronchus and the secondary bronchi and the tertiary bronchi, they're all held open by cartilage, but what are the tiny tubes held open by? It holds open the tiny tubes, the bronchioles. It's not cartilage. Becomes a problem during asthma. Well, surfactant is something that babies born premature don't have enough of, and it makes the water bead up in their air sacs, their alveoli. But the tubes that go to those air sacs, the tiny tubes that go to those air sacs are called bronchioles. And what holds the bronchioles open? What holds those bronchioles open? What? Smooth muscle. Yeah, it is smooth muscle. And if it all closes at once, that's asthma. So if you have an asthma attack, it's not your trachea that's closing or your primary, secondary, tertiary bronchi. They're held open with cartilage. It's your little tiny tubes called bronchioles. Guys, tell me the relationship between pressure and volume. Yeah, they're inversely related. So if pressure goes up, volume goes down and vice versa. Now, guys, what would happen if we made the pressure inside our lungs less than the pressure outside our bodies? No, I'm sorry. What would happen if we made the pressure inside our lungs, less than the pressure that surrounds us? What happens when we make the pressure inside our lungs less than the air pressure that surrounds us all the time?
Atmospheric pressure.
That's the atmospheric pressure. That's the pressure that surrounds us all the time. It's about 760 millimeters of mercury. What happens when I make the pressure inside my lungs less than 760? What happens when I make the pressure inside my lungs less than the pressure I'm surrounded by? No,
Exfoliation.
no. The pressure inside my lungs is less than the pressure outside. What's going to happen? Do it. Well, I make the pressure inside my lungs less than the pressure outside by making the volume in my chest cavity go up, right? So if I want the pressure in my lungs to go down, I need to increase the volume by contracting my diaphragm. So if I contract my diaphragm and I make more space in here, that will lower the pressure in here. And now the pressure in my lungs is less than the pressure outside. Well, guys, what would happen if I made the pressure in my lungs greater than the pressure than outside?
You stop breathing.
No, it doesn't. And we're constantly changing the pressures in our lungs.
And it wouldn't explode then, like a.
Well, not, I mean, if we, not if we don't raise it too much. So, guys, somebody's just gonna have to tell me what happens when I lower the air pressure in my lungs compared to the outside.
Like you're releasing air, your lungs are getting smaller?
Why don't we just all Google it? What happens? What happens when the pressure inside your lungs is less than the atmospheric pressure?
Inhaling?
Yeah. If I make the pressure inside my lungs less than the pressure outside, air will rush in, right? But when I want to exhale, I just need to make the pressure inside my lungs greater than the pressure outside, and air will rush out. Yeah. Yeah. So guys, let's think about this. I need to make, so we're agreed now that if I make the pressure inside my lungs less than the pressure outside, that's called atmospheric pressure, air will rush into my lungs because high pressure always rushes to where there's low pressure. Yeah. So if I want to breathe in, what do I have to do to my pressure inside my lungs? Lower it. Now my lungs don't have a pressure volume. So how do I lower the pressure in my lungs so that I can inhale? I have to increase something else, the volume. So we're agreed. Let's make sure we're all on the same page. In order to breathe in, I have to make the pressure inside my lungs less than the pressure outside. Yeah. Okay. So the pressure inside my lungs needs to be less than the pressure outside. How do I change that pressure to make it less? By increase the volume. And that's when I contract my diaphragm, right? That increases the space or volume, and that lowers the pressure. So air rushes in. Now, if I want to breathe out, I got to make the pressure in my lungs slightly higher than the pressure outside, right? So if I want to make the pressure in my lungs higher, what do I have to do to the volume? Lower it. And I do that by contracting my diaphragm. That pushes on my lungs, right? That makes less space or volume, which increases the pressure, so I blow air out. It's classic Boyle's law. Guys, I need you to know the pressure inside your lungs is called intrapulmonary. Now that ought to make perfect sense. Intra means inside and pulmonary means lung. Intrapulmonary. That's what all this is trying to show us. All right, I think that's kind of all we need from that. So guys, when do we have our exam? Next Thursday. Next Wednesday. That's right. So next Wednesday we have our exam. We over 7 and 8. I'll see you then. I'll see you in lab in 10 if you got lab with me.